All right. So as a reminder, all meetings get recorded with the chats. They get posted to the website and the Facebook after the meeting. So you can always find if you missed anything or if you want to share any resources. Um, I put in the chat and I'll share it again throughout the meeting. All of our various links if you want to follow the council throughout the year. We have a website. We have a YouTube page where all of our meetings get posted. And we have a Facebook where we put a lot of information throughout the year. So by keeping up with any of those, you should be able to keep up with the council and important topics that are going on affecting the IDD population throughout Brooklyn and throughout New York. All of our contact information is on our website. So if you haven't visited our website, bkddcouncil.org, it has updates, it has information on our committees, it has a calendar with all of the links for all of our upcoming meetings. It has contact information for each of the chairs, each of the officers of the council. And I will, at some point, we'll just go around and make sure we all introduce ourselves. So as we start the new council year, you know who we all are. So that being said, I'm Brian Rothenstein. I'm the chairperson of the Brooklyn DD Council. I know we have Rochelle Kibanoski on and Marjorie Antoine. So if you just want to quickly say hi to everyone.
Morning, everybody. It's good to see you.
Good morning, everyone. Welcome back. Nice to see everyone here.
Those are the two vice chairs of the council. We have Christopher Greif, who is the treasurer of the council.
Good morning, everyone.
And I haven't seen him yet, but we have Nigel Thompson from Kindred Bakery, who is the secretary of the council. And then you'll get to hear from the co-chairs of the committees that we have as they give updates and talk about upcoming meetings. The first thing I want to talk about regarding council news is you all should have seen reminders that now that it's September and the council year is starting again, agency dues. I know there's a lot of confusion. I get a lot of questions about that. So because the council year runs from September to June, every September we open back up membership dues for agencies. It is $150 for nonprofit agencies and $200 for for-profit agencies. All of the information is on our website. I've emailed out memos. I get lots of questions back. Unfortunately, we have no ability to accept electronic payments. So it has to be old-fashioned checks. All of the payment information is on the website, is on the memos that are emailed out, is on the newsletters that I send, or whatever we're going to call them, the what's happenings in your emails. It's at the bottom of those. If you have any specific questions, please email me on the side. But being a member not only gets you linked on our website for your agency, it also gives discounts to our big annual support fair at the end of the year. We are happy to announce we will be going back to an in-person legislative breakfast this year. So if there is a fee for that, there would be a discount for member agencies, but we haven't gotten to those details yet. It also helps maintain the Zoom platform that we run our meetings on, as well as maintaining our website. It's important to remember that we're all volunteers that are running the council. So I know sometimes people aren't necessarily aware of that, but we're all volunteering our time. We're either family members, parents, staff at agencies, and we're doing this on our own time on the side to make sure that we can continue to advocate for the best possible supports and services for families and individuals with disabilities throughout Brooklyn. All right, so that's membership. And I quickly said it, but I'll reiterate it again because I know a lot of people are going to be happy to hear this. We will be going back to an in-person legislative breakfast. I know since COVID, it's been a 5-borough virtual legislative breakfast, and we've heard the requests and the concerns and the wishes, and we will be going back to an in-person event this year. We are just starting to plan it now. We don't have many details except that we are going to say hold a temporary date of Friday, February 6th. That is what we are hoping for right now. We're trying to find a place where we can have it hosted. Paula, you have a question?
Yes, good morning. Welcome, everyone. Is this going to be just for Brooklyn, or is going to be all the boroughs as, you do it on Zoom?
So this, I don't know if all the boroughs are going to come together and also do some kind of virtual thing, but for Brooklyn, we would still participate if they're going to do that, but we are going to hold an in-person specifically for Brooklyn. I'm not sure if the other boroughs, I think last year one other borough did in person as well. But I'm not sure what all of them are planning yet. We haven't all the chairs haven't sat down yet and put our heads together. But for Brooklyn, we are definitely going to go back to an in-person.
Excuse me, Brian, this is Chris. To answer Piola's questions, the only borough I heard that discussing it is Queens. The other boroughs are saying to be announced or be determined, because right now they had a lot of meetings that went very long because of, how they catch up in the summer times also.
Okay, thank you, Chris.
Thank you.
All right. Other updates from the council. So one of the goals that we talked about on behalf of the Brooklyn Council is we're going to try to do a little bit better with being more consistent with scheduling our meetings. If you see meetings on the calendar, we're going to try to do our best to not change them. I know last year there was a lot of last minute changes or cancellations. And again, we are all volunteers with other responsibilities, but we know people look forward to those meetings and need the information. So we're going to try as best as we can to, if we put something on the schedule, to keep it there so people can plan and know when to expect certain dates, certain events, certain meetings. So please keep an eye on our website's calendar. We have the meetings on there with the dates, the links, if it's for the virtual meetings. And please feel free to email any questions as it leads up to meetings. If you're curious about how attending, getting more involved, just unsure where to find certain pieces of information, you can reach any of us. All of our contact information is on the website. And again, I put it in the chat and I'll put it again. We have a website, we have a Facebook, we have a YouTube page. So please keep an eye on all three of those and you'll be able to keep up with us throughout the year. All right. I want to pass it over now before we move on to the OPW update to some of our co-chairs to talk about their committees that will be taking place throughout the year. So let's see. Debbie, you want to go first with the Family Information Provider and Care Management Committee?
Sure. First asking, can you hear me clearly?
Yes.
Thank you. Only because my computer's acting up a little. Okay, good morning, everybody. My name is Deborah Greif. I'm the parent co-chair of the Family Provider Information Committee. Our committee, it works with, if this was a couple of years ago when we still had Medicaid service coordinators, this would be the MSC committee. But we've added the families as well as providers of different family support or non-family support OPWDD programs. And my co-chair is Miss Rose Saul. She is usually here, but she's with Brooklyn Bureau, but we had a really great meeting. We usually meet the second Wednesday of the month. So our last meeting was on the 10th of September. We had Malky, who is a lawyer, who did a great presentation on guardianship, what types of guardianship, as well as special needs planning. We will have her back. We haven't said what date yet, but we will have her come back because she was very well received. But we know so many people had so many questions and we didn't have enough time to give the answers. Now, I just want to say this, due to the Jewish holidays, because we do usually meet the second Wednesday of the month. In October, we're going to be going to Wednesday, October 15th, because we have to make sure we're not with either Simchat Torah, Sukkot, as well as Yom Kippur. So we haven't picked a speaker yet, but we do meet, and it's through Ring Central, and we meet from 10, but we're probably now going to 12, since we won't be sharing our time with when we were doing it with the legislative committee. But we will, if you also have any ideas or subjects that you think we should be addressing, please contact myself you can contact me either at bfssac@yahoo.com. Yes, I'm the chair of that committee council, but you also can get me with Deborah.Greif61@yahoo.com, as well as Rosal's information is on the Brooklyn DD Council's website. And please let us know what speakers you would like to have come or any subjects you feel we need to handle. So with that, I'm done, and I'll do my
Thank you,
other
Debbie.
council report later.
Thank you, Debbie. I also want to remind everyone, in some of the emails I've sent out at the I think the end of August, beginning of September, I did share a survey through Google Forms that we would love to get feedback. I think only 5 people responded, but we want to make sure that there's value in these meetings for you guys, everyone that's attending. So if there's specific topics that you would like to see, and whether we can fit it into a general meeting, one of our subcommittees, or we need to schedule a separate meeting for it, we can always do that. But we'll get the most value out of what you guys want to hear and talk about. So we did get 5 responses, but I know we have a lot more people that are involved in this group and that attend this group. We have 1,000 people on the mailing list. So don't be shy. Give us some suggestions, and we can make sure that these meetings are meaningful and worth your time. Because I know everyone's time is valuable, and we schedule a lot of meetings throughout the month. So we want to make it worth it for you guys. All right, next committee. Who else do I see? Maria, I see you. If you want to talk about the legislative committee.
Sure. Good morning, everyone. My name is Maria Willis, and I'm the co-chair for the Legislative Committee. Lucina Clark is the chair of the committee. And as Brian mentioned earlier, this year we are planning to have, well, next year, we're planning from this year, but it will be next year in February, an in-person legislative breakfast. So that's in the works. For the year, look forward to hearing from elected officials. I believe we have 2 lined up already that will speak about legislative issues, voters' rights, how to vote, what is on the ballot for this year. We have Senator Roxanne Persaud in the works and Assembly Member Monique Chandler Waterman. So we'll let you know what days they will be attending the meeting to give their presentation. Our next legislative committee meeting is scheduled for October 9th at 10 a.m. October 9th at 10 a.m. And it's a Zoom link. And I believe that's already on our website as well. Thank you.
Thank you, Maria. And that is one
You're
change from
welcome.
last year. The legislative committee has their own Zoom link now. They're different meeting days, so they won't be lumped in with other committees. So they will be on the 2nd Thursday of the month, and they have a Zoom link. It's posted on our website. So like Maria said, October 9th is their first meeting, and you'll find all their links on the council website, bkddcouncil.org. All right, the Meaningful Day Committee. I saw a few of you guys. No one? Bueller?
Good morning, everyone. I'm one of the co-chairs of the Meaningful Day Committee. We've restructured our committee practices, and we will be meeting probably the 3rd or 4th Thursday of each month. Our October date hasn't been set yet due to some of the restructuring that is taking place, but we're looking forward to an exciting new year with guest speakers. And also, as Brian stated before, an opportunity to get feedback about what folks really want us to address while we're having those meetings. So there will be a form or a survey that goes out to folks on our mailing list so that we can really structure the meetings so that they are meaningful for folks who are attending.
And for anyone that's participated in the past, thank you, Marjorie. Please remember our Meaningful Day Committee was kind of a combination to try to make it a little easier so people didn't have to attend 100 committees every month. It's basically looking at a person's whole life. So they can touch on early childhood services, transitional as an adult, work employment services, day program opportunities, things like that. So that's why it's important we get important hot topic issues from you guys, what you want discussed. If we can find presenters to come on or utilize the knowledge from all of our co-chairs who come from each of those worlds in the field. All right. And I don't see anyone from our residential committee. That's a new committee that started last year that we're still trying to get consistent and on the schedule, because we know residential and housing is a hot topic in Brooklyn and all throughout New York City. So we are working hard on trying to be more consistent with that this year. So I think that's it for updates from the council and what to look forward for going forward. I appreciate, for anyone that's new here, just know we always give a few council updates. We have great representation with Nina and Lucy from OPW. They always give OPW updates. We have Kate from IAC. She will give an Interagency Council on Developmental Disability update. We have Brianna Clark, who listens in from DOHMH and will bring back information she hears and sometimes come to us with information. So thank you for being here. And then we have MTA updates. We have Debbie's Brooklyn Family Support Advisory Council updates. This month, we have a great presentation coming up from Ruth from INCLUDEnyc. And then we always leave time at the end for agency announcements and updates. So that's typically how the meetings are structured. So now I'm going to hand it off to Nina from OPW for the update from OPW.
Good morning, everyone. Do you hear me?
We do. Good
Okay.
morning, Nina.
Good morning. So I'm going to share the latest developments from our agency. And I'm going to start with federal updates and all the concerns we have about the impact of the federal budget. New York State's current financial plan assumes a federal match of nearly $7 billion to cover the more than $13 billion in anticipated cost of the state's Development Disability Service System in fiscal year. The recently passed Big Beautiful Bill will have an impact on New York State Medicaid program and recipients, but no explicit impact on OPWDD service system has yet been identified. While OPWDD service system has no designated federal cuts, we know that cuts to health and other benefits will have significant impact on New Yorkers, including people with developmental disabilities, their family and staff who support them, such as devastating impacts on healthcare and hospital systems. Proposed changes would destabilize Medicaid programs and could cost the state $13.5 billion per year to put a coverage for 1.6 million New Yorkers at risk. Locating medical providers that will provide health.
Are you working? ?
I'm sorry. Locating medical providers that will provide health and dental care for people with disability is already hard in New York State and would become even harder for people with developmental disabilities to identify medical providers who would accept Medicaid and have availability, particularly in the areas outside of New York City. Mandatory work requirements for Medicaid eligibilities. People with developmental disability would be excluded, however. And so the work requirements for Medicaid eligibility could cost the state up to $500 million and cost millions to lose their coverage. Roughly $300 billion in cuts to SNAP nationally, endangering benefits for over 300,000 New York households. Additionally, significant cuts are expected for the Home Energy Assistance Programs and temporary assistance for needy families program, which will ultimately affect New Yorkers with developmental disabilities and their families who rely on these services. Prohibition on establishing any new provider taxes or increasing the rates of existing taxes. The bill also reduces the safe harbor limit for states that adopted the ACA Medicaid expansion, including New York, by 0.5% annually starting in 2028 and until the safe harbor limit reaches 3.5% in 2032. The new limit does not apply to nursing facilities or ACF. States must now provide eligibility redetermination every 6 months for Medicaid expansion adults. This applies to renewals that will be scheduled on or after December 31st, 2026. The more frequent redeterminations will apply only to the Medicaid expansion population, which is New York State, and non-disabled individuals under the age of 65 and with income below 138% of the federal poverty level. There's also cut funding by roughly $2 billion a year for New York for covering undocumented immigrants, most of whom are children. And that will be, the coverage will be provided with state funds only. There is a new HCBS waiver option. Effective July 1st, 2028, states may elect to request a separate HCBS waiver applications for individuals without a determination to need ICF level of care. This option has the potential to support OPWDD and the people it serves with less intensive and lower cost service option before a person may otherwise be determined to need a higher level of care and improving timeliness of service access for all people in need of support. So that is for federal updates. And now I'm moving up with our agencies activities. So earlier this year, we implemented capacity management system. The capacity management application is an electronic platform that will automate the certified residential opportunities procedural task. As you remember, we had the ADM, pro-ADM, that was published earlier this year, and the CMA system falls in line with the new rules and requirements of the ADM. The application will increase efficiency, improve reliability, increase accountability for people with OPWDD supports, and will provide overall improvement to our system internally as well as externally. CMA system is called CMA will keep referral packets up to date so they accurately reflect people's needs, and updated referral packets will help to promote timely screening activities and will provide accurate information to the providers. Phase 1 of the capacity management application was implemented in July 2025. Care managers have 7 months from the date when they entered the core referral form to upload current documents into the CMA for everyone on their caseloads on the CRO system. So once again, I know this question comes along. It's a new system. We had cases and packets that transitioned from the old system to the new CMA system, and care managers have 7 months to update the packets. Once the person has been added into the CMA, and to keep referral active, packets must be updated after each annual life plan review and whenever there are substantive changes in the person's life. A demonstration, user guides, a quick reference materials have all been provided to the care managers, CCOs, regional field office personnel. Additional training on CRO ADM has also been provided to the CCOs and voluntary agencies. Phase 2 and Phase 3 will be focused primarily on our residential providers and will occur later this year. So I'm going to move along and quickly mention that you probably are aware that self-direction program evaluation was completed by the Guidehouse. The final report is being under review and will be released soon in plain language. Earlier this year, I think in spring, I mentioned that our commissioner announced a task force on aging. And the purpose of this task force is to address aging-related needs for people with developmental disabilities. It's a time-limited subcommittee on Developmental Disabilities Advisory Council, co-led by DDAC and Commissioner's Office. The members include subject matter experts, self-advocates, family members, and providers and CCOs. And the goal is to develop actionable recommendation for aging supports for the individuals and for the families. I think you are aware that we have a new waiver service that was approved, home enabling supports. In New York City, we have person-centered services, ADAPT, Center for Family Support, who will be delivering home enabling supports to the individuals who live at home. And the services will include assistive technology, remote supports, health assessment, and coordination of services. Providers engaged, so the providers and selected providers engaged in the community of practice to facilitate the successful launch of this program. We also, I think I mentioned that earlier this year, that we working on rehabilitation to employment initiatives. The goal is to support New York State Employment First initiative and to create comprehensive career plans for individuals. We are collaborating with agencies, self-advocates, families. We, OPWDD, entered into a 2-year contract launched with City, and we have training classes available for agency staff. The training covers interpersonal skills, independence, community engagement, and employment transitions. I also want to quickly mention that OPWDD held informational sessions on CAS and CANS assessments. So we met with the agencies and on reviewing the CAS and CANS assessments. And we are preparing for family and individual sessions that will begin October 9 across New York State. Sessions will be held regionally. In each region, it has Hudson Valley, Westchester, Binghamton, Syracuse, Buffalo, Rochester, Long Island, New York City, Capital District, and Plattsburgh. Attendees must register to receive confirmation and translation, and ACL supports will be available. We will also have 2 statewide webinars that will be offered in November. One would be daytime, and the second one would be in the evening. I have tentative dates, November 4 and November 6. And presentations on CAS and CANS will also be posted online for on-demand access. One exciting update I have that we have announced $25 million in capital grant funding available for Article 16 and Article 28 clinics. Application deadline is on November 5th, sorry. And priorities include expansion of dental services, wheelchair accessibility upgrades, creation of sensory-friendly spaces, expansion of specialty healthcare in underserved areas. Funds may be used for building modifications, accessibility improvements, and specialized medical dental equipment. So funds are basically for capital improvements of the clinics. Applications will be reviewed and scored against OPWDD priorities. And all questions must go through OPWDD grants email to ensure fairness, and the applications should be submitted through the CFS system. Okay, I can send you the link for that grant. So whoever is interested, please apply. And finally, I want to mention that OPWDD reactivated the dental task force, and I'm following all the comments that we have heard from the family stakeholders earlier this year. Over 30 dentists are participating to strategize on improving access to dental care for our population. University at Buffalo is working on specialized dental clinic for individuals with developmental disabilities. And recently, OPWDD, together with Anderson Center, provided a statewide training on supporting positive dental experiences for individuals with developmental disabilities. And that wraps up my updates for today. Thank you.
Thank you so much, Nina. So before I see if anyone has questions for you, there was a few comments in the, and there are questions. There was a few comments in the chat. You give a lot of information and we appreciate you being here. People were requesting, is there a way to get a summary or written update that I can share out? Because there is a lot of topics that you cover.
No, we do not share the address. This is all I have. I mean, we are not.
Yeah, because you're reading off a document only approved for internal, right?
Right, internal
Yeah.
notes. Yeah.
So I know some people were asking, and that's how I responded, that typically OPW doesn't provide a written. I apologize for that, but you can look at the recording that'll be on the website and the YouTube. But I don't know if someone.
There's a lot of information that is available on our OPWDD website, actually. You know that you can go and have the updates. We are also working on various dashboards that will be improving. We are working on improving our website, right? And this is the task force, you know, I would suggest to visit our website.
Okay, thank you. So the first hand I saw come up was Rochelle.
Morning, everybody, and thank you again, Nina, for such a comprehensive report. I have 2 comments and a question. My first comment is, you know, I think many of us are very familiar with the federal cuts that are coming down, but hearing them listed in such a detailed way, I know sends chills down my spine. And I want to encourage everybody to join our legislative committee, because the only way we're going to make changes and stop some of this is by doing advocacy both on the federal and state level to remove those cuts and mitigate those cuts. So thank you, Nina, for the information for everyone. The second thing is, I want to let people know that I was asked to participate in the Task Force on Aging. I am very happy to do this. I think it's an extremely important initiative. We did hold our first meeting in Albany last week, and I want to ask everybody here to share your thoughts with me about what you think the priorities are for people with IDD who are aging, no matter where they live, and also for their families, and what resources are needed. We had a very productive first meeting where we did brainstorming, but I need all the input I can get from everybody so that we could make this a productive effort and that truly reflects the needs of people in Brooklyn in particular. So that I wanted to say. I will put my email in the chat. It's on the website as well. So if people want to get in touch with me. The last thing I have is I'm very happy to hear that OPW is going to be holding sessions about the CAS for individuals and families. Do you have the date for the New York City one and where it'll be?
Not yet. It should be posted as soon as we have the schedule available. I will share that for sure.
Okay, because some of us, have busy schedules and we want to make, and if it's an in-person, we have to allocate a fair amount of time to be there. So, thank you, Nina.
You're welcome.
Thank you. Paula has her hand up.
Morning, everyone. Again, good morning, Nina. It's just a few clarifying questions while you were speaking. In terms of the CMA list, you said that the packet needs to be updated every time that is a life plan done. Is that always or only if there are changes to the life plan? Always.
Yeah.
Okay.
Yes.
Always. So every year the care coordinator needs to upload new information about or upload information about the client. Thank you. Now, in terms of the self-direction, I missed the day of the report that is going to be released. Do you have the date when this release? No?
We are finalizing,
Okay.
Yeah, the most important thing that the evaluation was completed, right? Recommendations were made. We are trying to improve the system. And I know the last thing I heard that we are working on putting that together in a plain language and it should be posted soon.
Okay. Thank you. And the last question is that I believe I heard that Article 16 clinics are only gonna serve individuals who are OPWDD eligible only, or that is incorrect?
Article 16 clinic, I know that they are serving population, our OPWDD population, right? And also there were, you can do evaluations when you're trying to establish OPWDD eligibility.
Okay, so you don't have to be eligible in order to start receiving services.
If you can, for evaluations, right? If you are reaching out to Article 16 clinic, right? You will you can do evaluations there to establish the eligibility.
All right. Okay, thank you.
Could I just clarify, Paula, because we're monitoring this too, and Nina, thank you for that. But, so the understanding is that, yes, you'll be able to go for evaluations to establish eligibility, but for any ongoing services without established OPWDD eligibility, you will not be able to receive, for example, OTPT, counseling, and that's not yet finalized, but that we expect it.
I can try to chat with the central office, and if I have more information, I will bring it back for the next meeting.
Thank you so much. We appreciate that. And that's come up at other council meetings too. So we very much appreciate that.
Thank you. And Nina, one question that I have for you, not based on any of your updates, but just potentially if you could bring back to the team and get, maybe we can schedule for a future meeting. We get a lot of questions, and specifically it's come up more frequently regarding DAHAB and higher needs supports, specifically like one-to-one supports in DAHAB settings, where families are really struggling when their child requires that level, and most DAHABs can't provide it. And families don't know where to turn or who to go to when their child needs a one-to-one level of support in a DAHAB with wall setting. So if you could just, I don't know if you have anything to respond now. I know I'm putting you on the spot, but just to bring it up because we've gotten a lot of questions about that recently. So for a future meeting potentially.
The high needs funding is a waiver. That's something for the individuals who are enrolled in the waiver, and high needs funding is offered for someone who is receiving residential services or day services, right? To be eligible for the high needs funding, you must be new to waiver service and new to this particular day service, right? If someone is entering a DHAP service for the first time, the provider has 6 months to submit the application to OPWDD for high needs funding to submit the application. right? And there are several acuity levels, and there are several levels on the approvals acuity 1, 2, 3, depending on the individual's needs. Right. Currently, the high needs funding is determined by looking at the DDP2 and reviewing the life plans and BSPs. The other criteria when individual can qualify for high needs funding if there was a change in individual's abilities, right? If it was a qualifying event, let's say the person had a stroke and they no longer can walk, they're using the wheelchair and the person is not able to recover, right? And that would be a qualifying event to apply for the high needs funding because of the changes in medical condition. Right. I can share the mailbox. You probably, Brian, has it. You have it, but this is only, right. The rule, the bottom line, high needs funding is only either new, as a new service when the individual is asking for the service for the first time, or there was a qualifying event, and the individual needs increased support.
Yeah, so I think the frustration from the families is that agencies are just not offering it, and parents are stuck when their child graduates from the Board of Ed and they start applying for day habs and say, my child had one-to-one and continues to need one-to-one, and every day hab just keeps passing them down the line saying we don't provide one-to-one. And part of it is the staffing crisis going on around us and people not coming into this field like they did. And I guess some of the agencies haven't applied for the funding or don't feel like they can take it on based on staffing needs. So I think that's where a lot of the concerns from families come from. Rochelle, you have a comment?
I do. I guess part of the reason I think for this problem, and it is a big problem, and I think it becomes more of an issue for individuals with behavioral needs, support needs, even than physical support needs often, is that providers are not willing to accept the person until they get the approval from OPW for the funding. The funding is time limited, and it's not at all clear that the need for the one-to-one will be time limited. It could be ongoing, and that's true whether it's in residential or in a day program. And these supports are so limited, and then there's not clarity. I know you gave the criteria, the rules for who's eligible, but there's really not clarity for how these decisions are made, who qualifies, who gets denied. And so few people I know in New York City have qualified from our DDRO in the last number of years that providers are understandably gun shy. So I think this is a topic that really needs a lot more discussion and clarity so that people are not sitting home when they need supports. So thank you.
I think the first step would be to have a DDP2 completed, and in that instance, I would suggest that the DDP2 is completed by the provider who will be providing services, not the care manager, right? And then the conversation with the care managers on reviewing and seeing if there are additional programs or supports that can be offered to that individual.
Thank you. Debbie, you have a question for Nina?
/question/comment. One of the biggest issues I have seen for the families, when our children are in the Department of Ed, they push our children to go to work and do all their claim that they could be independent and everything. So a lot of parents buy into that, even though truthfully, their child is not completely able to be independent on their own, to travel, to even work. So then they are in a different kind of mindset. And then when they see what the real world is like, that like the bus doesn't come now every day, it's a big problem. We have to educate families that, yes, school's teaching you what to do, but at the same time, you have to accept what your child is not capable of doing so that your child can get the correct services. because I've seen too many kids, their families, oh, my child can do this and that. And guess what? They're still sitting home from daycare. And they all told me I was crazy because I always knew what mine and other individuals that I worked with advocate. Not look, if you really can't do something without somebody following you, like a para or a job coach, then you really can't do it independently. We really have to explain to families what this means. Independent. Can they travel on their own? Can they really do the job without a job coach? How is their social work skills? And no one ever addresses that. And the few families that do, we get pushed back by other families who tell us we're nuts. But then when our kids are succeeding because we're realistic, you know, it's painful, but we have to accept it, and they don't want to. And I also wanted to say a fast thank you, Nina, for when you were at our meeting, for answering all those questions we needed. Thank you.
Thank you, Debbie. Chris, you have a question?
Yeah, I just want to back up with what Rochelle said as well as Debbie, because you know, Developmental Disability Resource Fair, and Carrie and Ruth can vouch with me as well as everyone else. But when we ask when there's respite or ComHead or something has an opening, we need to know this because Brian, you need to know this. I need to know this. When service is open, I apologize. There's an ambulance outside that doesn't understand it's not an emergency. The concern is we need to make clear how can we help the families as a councils, and I'm saying that word because I know it's on my words. I'm saying councils with an S, because information is out there to help the families. And Nina, regarding dental, it is a bigger issue, everyone, because if I want to go to dental, I have to wait 3 years to get a dentist appointment. I think that's just plain nuts. So we really, really need to, if we have dental issues, we need to bring it up a notch on this. Thank you.
Thanks, Chris. Lucina, you have a question for Nina?
Oh, thank you, Nina, for the information. I think what we have, you know, as speaking to parents, we have to have the connection with the DOE, Department of Education, and the transitioning coordinator, also with OPWDD, because when the parents get information much earlier, and again, Debbie was saying, you know, educating the families, sometimes the families wait, you know, when the kids are ready to graduate to get information or what minimum information is given. So I think the communication with OPWDD, the DOE transition coordinator, and also the guidance counselors to start to give parents information early so they are prepared also. You know, and like what Rochelle was saying, no one really knows what's the criteria sometimes. I mean, a lot of these parents apply for the DOHMH. They don't know. They just, you know, looking to have a safe space for their child to be placed. So, you know, how can that be changed in that aspect? But I think it's the communication with having that early transitioning discussion, you know, in the schools as well as OPWD having transitional coordinators, and they're just plugging in information into the school system early. So at least parents will say, you know what, my child is 16. I don't wait till I'm 20, 21 to graduate. From 16, earlier on, they're getting the information. And I think that is quite helpful. If that connection is made, that strong connection. Thank you. And sorry, my camera is not working properly this morning, technical difficulties.
Okay, thank you, Lucina. We have the whole team in the regional field office who are working directly with school transition of kids who reside at home. I can bring someone next time to this meeting. They can talk briefly about the process.
Thank you, Nina.
Thank
That'll be
you.
great. And then maybe also, whether it's in this meeting or one of our others listening to this conversation, maybe we need to schedule an entitlement versus an eligibility type of session so families understand that it's different when you're in school and then when you age out and get into the OPW system. And talking about what the difference is, where everything is given to you in the Board of Ed versus you have to apply and be approved for everything once you leave. And I know that that's not always easily understood or explained to families as they're going through the school system. I also want to quickly bring up or just highlight a comment that Sue had put in the chat, that agencies should get approval for I'm assuming she means for high needs, if the family is willing to get the workers. I think that if the family has a worker, I think that's a huge relief for agencies. So I don't disagree there, that if a family comes with a worker, that should make it easier for the agency to go through the process. But every agency handles things different, and I don't know, every day habits run differently, so it all depends on the setup and the capability of each of the programs. But thank you for that, Sue. All right, Nina, I think you're off the hook. I appreciate you being here in the update.
Thank you.
Next up, I did see Rihanna from Department of Health. Just want to check in if she has any updates for us.
Hi, good morning. No big well, we do have our upcoming community service board subcommittee meeting. That's coming up on the 23rd of October. I'll drop the link in the chat. For any details, we just in case anyone's interested in attending, it's open to the general public. However, if you do want to come, you'll have to email me just so you can have access to the building, because it's being held at Gotham Center. So I'll put the information in the chat, and that's about it for us.
All right, thank you, Rihanna. Thank you for being here. All right, next I will pass it over to Kate from IAC for the IAC update.
Everyone, first of all, I just need someone to confirm for me that my background is not switched, not reversed.
No,
you're
Kathy.
good.
No, Kathy, you're fine.
Okay.
I
Okay.
can see you clearly.
I appreciate that. Thank you. It's my long-standing paranoia. Okay. I'm gonna drop 4 resources in the chat. These are not plain language. They are rather detailed to the extent that they can be around the federal changes that are a result of HR 1. I just wanted to include them now so that we're all going to multitask, right? So that you have them while I'm speaking, but also because Nina did such a terrific overview of the federal impacts to Medicaid. There's some things that are probably going to be a bit redundant, so I'm going to try to skip those. But I wanted to call out some of these resources for you. And also, as Brian knows, the council knows, at any point IAC is happy to come back and talk about the changes as we learn more about them. And that's really kind of where we are now. This first resource from Anchor, that is the IAC is for providers here in New York City and New York State, what Anchor is to national, all of our organizations nationally. So Anchor has created a really terrific resource that goes over the top line Medicaid provisions that are included in HR 1. You can look at those. It's relatively detailed and really helpful. The second resource is, pardon me, I'm not sure where I have is a timeline that's really helpful, because again, a lot of these phases will be over an extended timeline, years long. So while we keep talking about the impact will be phased in. So that is the second attachment, HR 1 key provisions. The, pardon me, third attachment is a specific, guidance document regarding New York State and the impact to New York State. And the last one is all about SNAP. And initially, when we were preparing for this meeting, we were going to talk a little bit more about SNAP. At this point, because we don't have regulations, we don't have additional guidance, we're going to hold off on that, and we're happy to come back and talk with you about more of the SNAP impact whenever we have more information. But okay, on to the report. My name is Kay Hoy. I am the Vice President of Children's Services at the Interagency Council on Developmental Disabilities. Thanks for inviting me, for letting us be here. We'll be back monthly to give updates on federal, state, and local events that are relevant to our discussions. So HR 1 was enacted on July 4th. It's also known as the One Big Beautiful Bill Act. I'm going to continue to refer to it as HR 1. Has a lot of changes to Medicaid and many related to work requirements, provider taxes, state-directed payments. New York in particular, more than other states, is going to be impacted by the changes, estimating that New York's going to lose between 90 and 150 billion in Medicaid funding over 10 years. In addition to, it's the management and oversight of those changes that is particularly challenging to implement. So we're watching that. New York's legislature is out of session through the end of the year. There was initially conversation that they would come back to address the coming changes, but they are not going to. There's no indication that they're coming back through the end of the year. So we are particularly susceptible, and we're going to wait to see what our response will be to all of the changes that are coming because of HR 1. So one thing in particular is the loss of premium tax credits for certain immigrants. I'm happy to come back and talk about that. But essentially, the Essential Plan, as it's known in New York, is a basic health plan under the ACA, and it's a bridge for individuals with incomes that are too high to meet Medicaid requirements. So otherwise, it would be a tremendous burden for them to afford a plan on the exchange. So New York operates under a waiver, allowing it to provide coverage under our Essential Plan for individuals with incomes between 138 and 250% of the federal poverty level. That's going to have a tremendous impact on New York. And there are certain types of immigrants and New Yorkers who will be impacted, including lawfully permanent residents. We are really concerned for our community here in New York, our providers, our DSPs. If you've ever been in graduate school, you may know how important those subsidies are. This plan is. There are rulings though that actually obligate New York State to provide the Essential Plan to certain classes of individuals. So figuring that out is going to be quite important. It's also going to be a tremendous financial burden on the state that we're going to have to learn or figure out how to fund. So that is not effective. Aspects of this are not effective until 2027. So again, the implementation timeline is delayed. It's certainly going to impact providers' revenue as well, because the Essential Plan pays significantly higher rates than Medicaid itself. So again, we're looking at a system-wide impact because of HR 1. SNAP, similarly, there's only one immediate impact to SNAP, and that is the education program funding has been eliminated. So that federal funding eliminated for SNAP education program was effective will be effective September 30th. Otherwise, the New York State Office of Temporary Disability Assistance is currently awaiting guidance from USDA on you're going to see this acronym everywhere, able-bodied adults without dependents related SNAP policy changes. So we will receive additional guidance from the New York State Office of Temporary Disability Assistance once they've received federal clarifications on the timing of implementation and needed system changes. So again, we're awaiting that. They have advised New York districts not to implement any of the following changes as a result of the act until the Office of Temporary Disability Assistance issues implementation guidance. So in addition, I'll just note, because you're going to see it in the news, we are awaiting any additional information from the president's office regarding, he plans to make a big announcement regarding Tylenol, we're not sure, and autism. We are certainly watching that. I'm sure many of you know there have been lots of research into paracetamol and any potential link, and that has not been found. But again, we are awaiting that announcement. Right now, Congress is in the midst of the federal 2026 appropriations process. Just for context, funding to keep the government open runs out on September 30th. And right now, to avoid a government shutdown, they have to approve a new funding package by September 30th. They're quite far apart on certain provisions. I'm not sure how much you want me to go into the weeds here. I know there's a presentation, so I'm sure everyone is following this. If you want me to go into it a little bit more, I'm happy to do that. What congressional Republicans had been pushing for and what the White House has been pushing for is a clean CR, meaning that funding would remain flat. The funding from 2025 would be the same for now until it's a temporary funding measure that keeps the government open. And Democrats are demanding certain healthcare provisions, so including an extension of enhanced advanced premium tax credits in exchange for their votes. So we are watching that now. Congress is in a district recess, meaning that they are not in Washington. They are here in district through Sunday, actually. So that leaves them relatively short amount of time next week to come to an agreement on certain provisions or not. So we're watching that. Winnie and I were in Washington with Anchor 2 weeks ago, meeting with legislators and advocating for our communities. And we were advocating for specifically 3 things: to support and strengthen IDD services through the HCBS Relief Act, which would increase the FMAP by 10% for 2 years, to support better data collection through the creation of a standard occupational classification for DSPs to collect data that would help in advocacy and rate setting, and then also to repeal harmful limitations to state Medicaid financing, including cuts to provider taxes and state-directed payments, which are detailed above and are in those resources that I gave you guys. Pardon me. I'm going to try to move a little more quickly. Earlier, education. I want to thank everyone for their advocacy. There were some really harmful provisions particularly in the House legislation earlier this summer regarding the budget. Under the House bill, at this point, all parts of IDEA would be funded. Again, the House and the Senate have to agree on a bill in order for it to pass, and they have not done that. There was a proposal that in the president's budget that would eliminate the IDEA preschool program and IDEA Part D programs. They would be rolled into Part B. Although that is no longer part of the House or the Senate bill, there are severe cuts to Title I that have been proposed and that that have been introduced up to the tune of $5.2 billion. Your advocacy matters. I will put something in the chat that you can please, click through. It's a one click as they continue to debate education funding. There it is. I just wanted to include that some of our incredible Part D parent resource centers, including INCLUDEnyc, Advocates for Children, and others, including the New York Deafblind Collaborative, are Part D, do receive Part D funding. It is very much a local issue. One parent resource center, community parent resource center, was recently informed that their grant will be terminated early. They are a tremendous resource to our community. There are other CPRCs in other states that have had their grants terminated early. Your advocacy matters, and this impacts all students with disabilities and particularly their families and parents who need high quality information. So I'm encouraging everyone to please advocate as much as possible. You may hear again that special education funding hasn't been impacted, and it's just not true. So just a couple of notes for your advocacy this fall, and based on our meetings with the legislators last week and their staff, they've advised us, first of all, Senate Republicans and congressional Republicans know how unpopular this bill is. There are attempts, and there have already been bills introduced to rename it, to rebrand it. Please don't let community members and legislators forget who passed this and what it will do. They can rebrand it in any way they want. It's still HR 1. It's going to be incredibly negative for our community. So just remind your neighbors, friends, and colleagues of how bad it's going to be for people with IDD and their families, and particularly for our workforce. we just want to continue to put pressure on 7 Republicans who voted against our community members' interests and voted to pass the bill. The message that they, in terms of strategy, that they conveyed to us was, asking for a repeal of HR 1 is pretty unrealistic at this point. So asking for implementation delays, asking for certain provisions to be revised, but they really stressed implementation days. They stressed that this is going to be a piecemeal effort and that, more guidance would be coming soon. And certainly when we have that, we would pass that along to you. If you have met with members of Congress in the past few months, and so many of you have, send them an email. Let them know how much you either appreciated that meeting, appreciated that, what they tried to do, or if they voted against or voted for HR 1, you can ask them, let them know what you're worried about and ask them for another meeting. I'll come back and talk about SNAP. State advocacy, while OPWDD hasn't been given a specific target for cuts, they're looking for ways to reduce expenses without impacting services. So the Division of Budget has asked stakeholders to identify unnecessary regulations that could be eliminated. Provider associations are looking at those to support this request. While this year's cut is only $750 million, there will be expanding and additional reductions that will take place each year through 2035. So we're working with the statewide coalition to do that. NIDA is looking at a variety of ideas for budget requests, including supporting DSPs and other staff through housing and childcare initiatives. We'll also be asking for the July CPI for a targeted inflationary increase. We don't say COLA anymore. It's not just a COLA, it's an inflationary increase, and we're looking at 2.7%. For 4410 and 853 programs, special education preschools and special education school age programs, we're in the process of formulating those asks, and that will largely mirror the SED budget request letter that's due in mid-April. Early intervention has been severely underfunded for years. We are in the midst of an advocacy campaign to educate our legislators about the importance of the early intervention program, and we'll come back with more. We really need to inform our legislators of the importance of early intervention, and providers are desperate for a rate increase. They haven't received one since the 90s. Nina talked about the RFA for regional disability health clinic programs. Just wanted to reinforce that. Just a reminder that PHP is scheduled to end 12/31/25. There are 1,700 members who will transition back to fee-for-service unless they choose options for Medicare plan enrollment. There was a comment that providers are, owed money. There's a demonstration project. We will share final data on successes and issues, which will inform our future work in that area. State education, just one note as I attempt to wrap up quickly. FAPE 22, I imagine Ruth will probably talk about this. So over the summer, there was a ruling in agreement with the state education department that reaffirming districts' obligation to provide a free, appropriate public education to eligible students with disabilities through their 22nd birthday, provided they have not yet received a high school diploma. It also encourages legislative advocacy by organizations, families, and individuals to ensure that districts receive state aid for educating students with disabilities between 21 and 22. That aid was not part of the ruling. It was not part of the suit. So while it reaffirmed the responsibility to provide an education through age 22, it did not include funding that would require legislation. And similarly, we need legislation to determine if students are eligible until their 22nd birthday or through June 30th, depending on when they were born. If they were born during the school year, September through June, if they would be eligible through June 30th of the year that they turn 22, or for extended school year services if their birth date is during the summer months. So just a note that the Office of Special Education Youth Advisory Panel has openings. I will put that in the chat whenever I'm finished. And it's just too long for me to put in there now, but encouraging youth who are 18 years of age or older to participate in a youth advisory panel through the Office of Special Education. I'll put that in the chat. There's an upcoming hearing here in New York City on language access for the Department of Education. It's on Tuesday, 9:30 at 1 p.m. So next week. You'll have to register if you plan to testify, but you can always submit written testimony up to 3 days, 72 hours after the hearing ends. Here's an organizational sign-on opposing federal education cuts. This is an organizational sign-on, so not for individuals, but we would like to encourage as many organizations as possible to sign on for this. And that's really it, other than just wanted to let folks know that IAC is launching a years-long effort called IAC Votes to partner with local organizations and community members to get out the vote. We know that we have an election coming up in November, but particularly focusing on the 2026 midterms. We want everyone to be empowered to vote, to know that their vote matters, and to ensure that everyone is registered to vote and has a plan to vote. So we'll have more information about that coming up soon. But just for this coming mayoral election, the last day to apply online or by mail is October 25th. And the last day to apply in person at your county board of elections is November 3rd, 2025. Hope everyone gets out there. That's it. Thank you. Sorry, I know that was long.
Thank you no, that's okay. Listen, it's
I
our
haven't
first
seen you
meeting
guys
of
in a
the
while.
year. Yeah, there's a
Okay.
lot to catch up on. So we appreciate you being here and all the updates. And for everyone that was trying to keep up, Kate did a great job of putting a lot of notes in the chat. And again, the chat will be uploaded on our website when the video recording is uploaded later today, usually. So you can go back through the chat. She has a bunch of stuff in there that she spoke about. And IAC always is good at emailing out different information. So I'm sure you've seen some of this information as well. So thank you, Kate. I do see Chris has his hand up for you.
Yeah, Kate, I also put in the chat for you, and this is the reason, since Debbie and I are on the board election accessibility committee, they're reminding everyone, and this is why I'm putting it back on again. They're reminding if you have not registered to vote, please go online. Do not mail it, because we're seeing that the mail gets lost and they don't get a chance to register. They will still can vote with an absentee ballot. That will still count. You also can vote not just an absentee ballot, but accessibility ballot. That comes into the email, and once you print it out, they will send you the envelopes, and you can bring it to any of the early voting polling sites in the 5 boroughs, and they will count as voting. That is the one thing that everyone, I know I did this on Friday with Carrie. I did, and it's going to be on the October 3rd as well. But it is important that this link is there. And it also will tell you where you're supposed to vote is also linked on the QR code. So you have that chance to please make sure everyone is registered to vote. And just remind them, if you skip a year or two, your name is, because you have to vote every year. If you skip, they take you off because you can't. That's not me. That's Board of Elections. So don't come look at me strangely. And Kate, just to let you know, and everyone else to know, because this is for IAC, because everyone's asking me this in the chat privately. The only state today is not getting cut on the transportation is New York. We're the only state that is not getting any cuts. So I want to be very clear on that because I'm getting questioned. I want to be clear on the record. So, Brian, you hear me at this on the record. New York will not get any transportation cuts at all. We're the only state. You can thank God congestion pricing is holding us here. That's all I got to add. Thank you.
Thanks, Chris. Any other questions for Kate? Otherwise, we'll move on to our presentation with Ruth from INCLUDEnyc.
Sorry, the only thing I would say is please, reach out to Brian and your other committee chairs if you have topics that you'd like them to pass along. I mean, you're always welcome to email me directly, but Brian, keeps his agenda. So if there's anything that IAC should be aware of, please do let us know. Thank you. Or if you want to hear,
like for example, that there was there's been a lot of talk going around about the vaccinations, and Governor Hochul is putting out new provisions of who's allowed, what's allowed, who's supposed to cover it. So aside from reaching out to Kate to try to get information, we also reached out to our friend Rihanna at DOH. So she's reaching to her contacts at DOH to hopefully maybe have a little more detailed update for us next month. So when things like that come up and you want specific information, definitely let us know, because we could reach out to different resources to try to get it for you. Debbie, you have a question?
No, I wanted to know, when should I do my report quick?
Oh, so I'm going to let Ruth go because we're already running over. And then when Ruth is done, I will let you do your report. Chris, give a quick MTA update, and then we'll open for announcements from the agencies.
That's
Okay,
not a
and also
problem, Brian.
just want to let Kate know, IAC is always welcome to the advisory council meeting if they want to update us too. We'll send their, you're welcome. We'll send you the info.
All
Kate,
right.
Kate, can you give me your email, please? Because somebody's asking me.
She'll drop it in the chat for you, Chris. All right. So I'd like to introduce from INCLUDEnyc, Ruth DeRoma, and she's going to do a presentation on, I guess, navigating the school system for early, right?
Well,
I know that's not the official title. I'm sorry.
It's okay. Thank you all for having me. I'm glad to be back. Haven't been here in a while, but I will be coming because after seeing and meeting all of you again, it's really great to see all the work that you're all doing. And I have a little bit of a PowerPoint, but I think I'm just gonna wing it with you all because I know we're running way over time. There's lots of friends here, lots of people I've worked with over the years. Include has been around for 40 years. We are the New York State Family and Community Engagement Center, both for early childhood and school age students, though we do go up to age 26. Anything having to do with special education. We have family educators who can answer questions and make sure that parents are navigating the special education system, be it with New York City's public schools or charter or non-public schools. And we have a helpline that is active, and we answer every call and return every call. It's one of our most important features. We do workshops. This Thursday at the Brooklyn Public Library, we will be doing a workshop on busing, which for our folks can be extremely difficult. We did a workshop last week for ADAPT, and there were about 250 parents and professionals there, which was wonderful and mind-boggling. So for anyone who didn't know or wasn't able to attend, this Thursday at the Brooklyn Public Library, we will be there again doing a busing workshop. It is a very, very large concern for so many of our parents, especially for our parents with children with ASD, DD, ID. We are there. We do special events coming up in October and November. We have an event that's called College is Possible. There are 2 days. The first day in October, it's October, and I will get Brian some flyers. The first day is October 23rd in the evening, remotely. We'll be talking about the pathway to college for all students. Anyone that's getting a diploma certainly can go on to college. And on November 6th, we have another, it's under the heading of College is Possible, because there are programs for people with autism, DD, and ID in colleges. And for many students, just think of the benefit of them being included in college programs. So we will be hosting these 2 programs. All of this information is on our website, which is www.includenyc.org. As I said, we've been around for about 40 years. We have events and lots of workshops. I noticed earlier that I think Carrie asked about eligibility versus entitlement. We do workshops on that because it's so important, especially for our high school students, if not before, to understand how things change. Whereas in school, you are entitled under the IDEA. When you move into after school, after graduating or leaving school, you then have to prove your eligibility. And we do have workshops that touch upon that topic or those topics. So please, for those of you who know us, please continue to work with us. For those of you who are new to our services, please call upon us both through our helpline to help parents individually answer their questions. Sometimes parents don't necessarily want to talk to the New York City Department of Education, New York City Public Schools. They need some outside help. They need to be able to really express their fears, their concerns, and make sure that they are getting the help they need without kind of, putting it all out there to the people with whom they are working within the school system. So please, we are an outside third party. We work along with the New York City public school system, but we are a private nonprofit agency. So please make sure that, you tell your parents about it. The majority of our calls do come from parents with children with ASD, DD, and ID. And we know that because of all the services and supports that you need. So we're a kind of a clearinghouse for information about special education and other services. We do workshops, we have a helpline, we have special events like College is Possible. We will be having the Include Fair, which brings together about 100 different programs at the Shed in Hudson Yards. And it's a wonderful day, specifically of different kinds of services that parents can sample and talk to and move forward. We do this in January because believe it or not, preparing for the summer has to start early for the following year. It's kind of hard to believe since today is just the first day of fall. So if there are any questions, but please reach out to us, have your parents directly reach out to us, call us in to do workshops. There's a list of the workshops on our website. And please make sure that you use us, that we're here. And as Katie Hoy said, yes, we're here. We're going strong. We know what's happening in the world, but at the same time, we're still going strong and we're here to help. Okay, Chris has his hand up, I think. Christopher.
Hi, Ruth.
Hi.
I just wanted to share a little information because Ruth, I know her for a long time. And Carrie and Debbie will agree with me as well as everyone else. If I say everyone else, then we'll be here till next year. Ruth, I just want everyone to know, during COVID times, Ruth's agency also together we were helping families during COVID season when school students can't go to school and try to get tablets, how to work on the Wi-Fi, encourage the families. And you know, the best part is during our link to the other council's websites is Ruth's information is always up to date. And Carrie can bounce that with me as well as Debbie, because her when Ruth took over I do have a message from Gary Shulman, the legendary. You're the Gary Shulman 2.0. So the legend continues with all those lovely information and helping families with the camps too, and helping the families with IEPs. And the one thing I hope, Ruth, that we can still continue working on is there is an issue out there with IEPs with students who try to use the school bus and the schools are not following the IEPs. There's a big issue with schools right now. And I know Chris Treatment was working, I know Kate's going to be working on it, but it's still an issue today. And there's a lot of things we got to help these school students to get, transportation for them. It's not easy because not everyone is fully travel trained. So there is a lot of issues. I hope in the future.
I
Yeah.
actually do work with OPT. I mean, I don't work with them but I mean, I am able to talk to them and they do answer
Yes.
me. So I've got I do have a lot of the background information, and there are things that parents need to know that they need to get in place in order to make sure that busing appears on their children's IEPs and that the process behind the scenes is being completed. It's not enough for that little box under transportation to be checked off. There's stuff going on behind it, codes and things that the IEP team needs to put into the school system's computer system, and that has to be downloaded to OPT. So there are things going on behind the scenes. And if any, I hope some of you will join in on the, or ask your parents to come to our workshop on Thursday, because we talk about what needs to be done in a larger sense. And yes, Katie, thank you. This is a scary time for everyone. And we are doing good work and we are helping thousands of people every year. So we, of course, have every intention of continuing. We are working hard. I have not stopped working in the last couple of weeks. It has just been unbelievable with the number and amount of calls and information that we have been, forwarding to parents. So please, if you have students, families with children in the system and a question comes up, please give us a call and we are available to help and get through the whole thing. I'm not going to take up a lot of time. Didn't go through the whole presentation. Brian, I will send you the presentation so that people have it and can look at it. And please, so just keep us in mind when people start to talk about IEPs, special education, and all the surrounding services. Very often there is yes, I know, Ellen. And very often there is there's a solution to things. And sometimes we just need to know in which direction to go. And that's where we come in beautifully. We can help parents help and advocate for their children. Okay, so I'm going to turn it back over so you guys can all finish. I've hope to have made some new friends. I love my old friends that are here, and it's good to see you. And I hope that we continue, and I'll be back at your meetings, and I hope we can continue on the pathway to serve our families. So thank you.
Thank you so much, Ruth. Thank you for being here, and I look forward to receiving the presentation to share out. I'll attach it on the website with the recording. I think families will really benefit from that.
Great.
And as we get specific topics from families, I'll share them with you because maybe you come to a subcommittee and can do specific presentations so we can get a group just for certain topics that they're interested in.
Thank you.
All right. Thank you for that. So now I will pass it back to Debbie so she can give her report from the Brooklyn Family Support Advisory Council. Debbie,
You
you're
forget
muted.
to unmute.
No, I didn't forget to unmute. My mouse died. I had to attach it to the computer. Sorry. Okay. Thank you, Brian. Okay. We had our last meeting on September 16th. I also gave an update of the statewide meeting that was on Monday, September 8th. Now, we have a new deputy direct commissioner. He gave a full report to us on the updates with the Crow list and the requirements that Nina brought up about the residential list. And they explained, we were able to understand it. And my families we're going to have another meetings where we have them explain how our care managers with us to determine when our children may have to be placed residentially, what to do with them. And Chris will also attach the statewide information in our notes from our meeting. We also were told that self-direction, they're working on the process to make it more easier to get on. So we're looking forward to that. And we also were told that they're going to be on October 28th in Albany at the Plaza. They're going to be, it's 2 days, October 28th and 29th. They're going to have an employment update, pathway to employment, and they will have a benefit specialist there because it's very important that when our children, when they do go to work, you need to understand the financial benefits too, because you do not want your child to lose their Medicare or Medicaid. And many of our children do end up after now because collect Medicare under their parent, but get Medicaid through there. And if they have too much income and they don't have, and if is not careful, they can lose their Medicaid waiver. You're allowed to have up to $1,500 as long as you don't make one more dollar than mom and dad, and New York State will pay for your part A and B, as well as you will keep your medical benefits, because Medicaid only lets you go like a little over $800, and then if you go too far up, you have to do a buy-in. But since our population, our children were born with developmental disabilities and were considered disabled before the age of 22, they qualify what's called either a DAC or adult child survivor. So they did tell us that it will be addressed there. They also explained to us about how the CAS is going to be updated. A lot of my families were very happy to hear that. And also our statewide families were very concerned because we wanted to make sure that when the CAS is being used, that how to make sure the information is there is correct. So we had a great meeting, and yes, people do know about the RFPs. I am not mentioning it because there's no updates yet. Once there are updates, OPWDD will announce it. Our next meeting is going to be on Tuesday, October 21st. We're going to do it on Ring Central. We're going to ask Nina and then from OPW if they have any more updates. But if Ruth or any of the even IAC want to come and update us, and Rochelle, if you want updates, because we must advocate very strongly not to lose any of our benefits. So we look forward to seeing everybody there, and I want to thank everybody. Okay, I'm done.
Thank you, Debbie. And for anyone new, we also post the Debbie's committee, the Brooklyn Family Support Service Advisory Council, on the link is on the Brooklyn Council's calendar on their website.
Oh, Brian, I forgot one thing. October, this past Friday, we had our first outreach. We do our outreach to different libraries, partnering with Carrie Banks. We were at the DeKalb Library. It was great. We had more people than we expected. Our next one is going to be on Friday, October 3rd at the Eastern Parkway Library. That's going to be no, it's not Grand Army Plaza. It's further down where the Utica Avenue is. And if you come by train, because there's no parking there, it's accessible because they have a great elevator there. So if you can't, we run out of space for tables. That doesn't mean you can't still be there, because we've already shared information from all the agencies that come to give me their information. We give it to Carrie, and they share it with all the branches of the library, as well as we also had the Angel Haskell Library, which we're still advocating to not to be closed or affected at all. Thanks, Brian.
And these are great mini resource fairs that Debbie and her committee work with Carrie at the library and do throughout the year, and then leads up to our big event in June for the Brooklyn Council. So it's great coordination and collaboration between the two committees.
Yes.
Carrie, you have a question?
Just a quick comment. We were actually at the Marcy Library last week.
Sorry, but I got the right street.
You got the right street, but yeah, it was at the Marcy Library.
Yeah, I wrote it too tiny for me to read. Sorry.
Sorry. And we are definitely looking forward to doing next month at the Eastern Parkway Library, which is also, by the way, a adult education center, and they have literacy classes, family literacy classes, for adults learning to read.
Thanks, Carrie, for fixing it. Thank you.
Great, thank you. And Chris, do you want to?
Before you do that, I do have just want to add to back up Carrie and Debbie. We also, just so everyone know, we also had a special guest star there, Christina Singh, who's the first person who started the sign language for the combo, and the Neverlands was also there. And we did have some other people popping in. But I will say this, the attendance that said 40, no, we had 44. So I just want to be clear, because the attendance,
40.
I still say 44, because you think about it, the next block over is Nostrand, B44. So it's got to have a little joke somewhere. But thank you, everyone. Just want to let everyone know that resource fair went really well. Thank you.
All right. So next up on the agenda, thank you, Debbie. Chris, can you fit in your MTA update in 2 minutes?
If I don't get interrupted. You know what? I'm just joking, Brian. First of all,
the timer, go.
Good. Good morning, everyone. Hope everybody's well. I did send my report to Brian, and I just did it this morning. Here's the good news. I gave already a piece to I already said earlier. There is no cuts. But I am going to remind you, please read my reports when I send them out. The other thing, I'm just going to remind everyone that please, for student Omni cards, please do not laminate them. You laminate them, they go kaboot. That means you destroy them. Leave them alone where they are. Just tap and get on. Those are they're like this, but I don't make that decision. That's a city issue. So you got to deal with that. The other thing is we do have, for Brooklyn, we do have the R211 train running on the B. So Ruth, you have 5 B trains running as of today, running. And we do have a lot of new station openings just passed, and we have 12 more stations that's on the list that I did mention in July. One is near Cary, one is actually further up north. So we are seeing stations getting up to date. All that information is on my report. I am going to challenge anyone who has a question for me, because you got a lot of questions that was on the chat. So I want to be very clear. You must have your Omni cards. Please make sure they're up to date. Please make sure you sign up for the account. And second, I have an event coming up that's in the chat for November 20th for Brooklyn. Everyone is welcome. There's one October 16th in Queens. That is available. That I already emailed it to Brian. Any questions that you guys have? Because I can see it from the eyes from here.
Hey, Christopher.
And Chris's full report will come out. I'll send it as soon as this meeting is over.
Amy had a question.
Yes. Do you have an email that if we ever need to get in contact with you, that's an appropriate email? Or maybe you already gave that. I didn't see that. And also for Deborah as well. I'd love your emails if you would be kind enough to put them in the chat, if that's appropriate. Thank you.
I already did Debbie's, and it depends. If we're talking about the 2 forums, I will, that email, I did put that into the chat. I will re-put it back in a few minutes.
Oh,
But
no worries.
yeah, I never get worried on that. But just to be clear, these two events that are coming up, we will have not just MTA, DOT, TLC, and New York City Ferry will be joining with me in Brooklyn, not in Queens. So, because the person who was supposed to do it, she can't make it, but she might give me information, which I actually do have here with me. I also will have the Omni card, student Omni card, not the card itself, the information, so people understand how to get the card. Because remember, we don't control it. The Department of Education handles that. So I just want to be very clear.
Thanks for that clarity. Appreciate it.
Yes. Mm-hmm.
All right. Thank you, Chris. I don't see any other hands or questions in the chat for you right now. Oh, Angela has
Hold
questions.
on. Yes, Angela.
I have to unmute. Hi, good morning, everyone. I hope you all had a great summer. Mine is just a quick update. We are getting ready to do the checklist reports for all of the agencies. They were sent out by Denise Alton to your executive director, and I have sent them out to all of my agencies. Hopefully, I didn't miss anybody. They're due back by the end of October. And once we get them back, we will start scheduling meetings, and then we will work with Deborah Greif and Christopher Greif and their partners to see what dates we will schedule the meetings for so that we can get through this review as quickly as possible. Just want to make sure that all the agencies know that it was sent out. I think that's about it. Thank you. Have a good day.
Angela, what reviews is this for?
The agency reviews for all the programs.
Got you. Okay.
I don't think I have you, so you're safe.
We had one the end of last summer.
Okay.
Oh, Brian, there is one thing, just want to be clear, because I'm glad Angela pops in, because this relates to their office. The Queens redesign is fully in service. The Q8 bus that goes to their location, that bus has not been changed, just adjustment of stops. Just want to remind everyone, because this just came on the chat. The bus stops are not MTA, they're Department of Transportation. You can both email both of them and they will check it out. You still have till the end of the year to make your final decision about a bus stop that was temporarily removed or linked. They're not removed, they were combined because some stops are too close to each other. And I don't have information about Brooklyn redesign at this time. Once I get it, I will let Brian know and Rochelle. It's
All right,
on my
Chris,
list,
I'm going to have
Rochelle.
to dock your imaginary voluntary pay. You went over your 2 minutes.
It's okay because it's 0 times 0.
All right. No, we appreciate the updates. Thank you. And now I'm going to open it up for any agencies that want to make announcements. Please just raise your hand and I'll get through all of them. We still have about 15 minutes left on this meeting. So any service openings, announcements, cool things you have coming up throughout the borough. So the first hand I saw up was Paula.
Good morning, everyone, again. I just want to announce I am from the New York Lawyers for the Public Interest, and I've been in the special locations. Our agency has been in the special location space for many, many years. I know Ruth. We are work often with advocates for children. We also Legal Services of New York in trying to push, better services for our kids with disabilities. With that in mind, we are having a special education Know Your Rights training via Zoom. In Spanish, it's going to be October 15, 10 to 12. And in English, it's going to be October 16, 10 to 12. I already copied that information in the chat with the link to register. So whoever is not able to attend to Ruth's training in the library, please give flyers so they could attend my training here at New York Lawyers for the Public Interest. Is soon. I put the link on the chat, but I'm gonna send Brian the actual official flyers so he could distribute it to the whole list. And please, send it to parents because it's always very important information. We do represent families and kids with disabilities for free. This is a nonprofit. We don't charge. So, you know, and if you have an issue, a concern, you can call our main line and we'll always assess every caller. Even if we end up not taking your case, you will get an assessment saying, you know, this is what you need to do. We're not going to be able to help you, or we're going to be able to help you, and this is what you need to send us. So we always there for the families. We've been doing this for many, 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 many years. My second announcement is about the Ombudsman program. As many of you know, there is an ombudsman program is to assist individuals with developmental disabilities and their family. This program aims to act as a resource and advocacy. So you will get individual assistance, you will get advocacy, and it's not a Know Your Lawyers program, by the way. Is just announcing for them. And you can call their main number, which is 800-762-9290. And they have a full staff of individuals waiting for your calls to address, you know, any issues that you may have regarding, you know, questions, concerns about OPWDD. That's it. Thank you, everyone.
Thank you, Paula. And I just want to give a quick plug in case people jump off. Our next month's meeting is the October 27th at 10 a.m. And I believe as of right now, we're supposed to have a representative from the New York State Office of New Americans on the Ramirez June initiative. So that should be a really good presentation. So come back for that. Next up, Jay.
Good morning, Jay Kleiman from LifeSpire. We have, what do we have? We have crisis intervention in Brooklyn. So that's, you know, families who are having any kind of issues, could be behavioral, could be, you know, whatever it is. We provide short-term counseling, case management, referral and linkage. And I put my information in the chat, but it was probably about 100 announcements ago, so I'll put it back in there so it's more recent. And also, putting on a different hat, the Queens Family Support Fair is coming up. It's going to be Friday, November 14th at the Flushing Sheraton. And I'll put the, again, that's in the chat, but I'll put it up there again. There's a registration link. Okay, thanks a lot.
Thank you, Jay. Carrie?
Hello. First of all, I'm putting the information on the October 3rd fair back in the chat again because Chris asked me to. So that'll be there when I'm done. And then secondly, I want to call out a couple of things. One is that busing workshop that we're doing on Thursday, the 25th of September, in person at the Bedford Library, which is near the Franklin Avenue Shuttle and the A train, A and C trains. It's a fully accessible station. There's a bunch of buses that go there. You're gonna love it. Brand new, renovated, beautiful building. So join us. Send your friends, families, and the people you work with to join us. We hope to see you there. Fine. Lots of other things going on, but I want to also make sure that I mention our INCLUDECon on Sunday, October 26th. I'm not used to Sundays. I've always got to check the dates at the Central Library. So this will be an autism and sensory friendly Comic-Con at the Central Library. The library itself will be closed so that we can sort of limit sensory inputs and issues and things like that. It's going to be it's a great space. It's your chance to see it behind the scenes. It's going to be a really exciting event. It is for neurodiverse teens and adults ages 13 and up who love comics and manga and all that stuff, graphic novels, things like that. So to find out more, again, I'll put my information in chat. You can get in touch with me directly. And but it is registration only, and I suggest that if you know someone who's interested in coming, they register soon because it's filling up very quickly. Again, one of the things that makes it sensory friendly is limiting the size, limiting the crowd. So we hope to see you there, and we hope that you're going to register soon. If you do register and turns out you can't come, please let us know so that we can let someone else in. So thank you very much, and I will be here for questions.
Thank you.
And
Erica?
happy first day of
Oh.
fall. I almost forgot the most important thing.
Thank you. All right, Erica.
Good morning, everyone. I am Erica Thorpe, and I'm going to tell you about some openings we have here at Heaven's Hands. We have openings in our ComHab. We have openings in Respite, as well as our day program, which are site-based in Sunset Park and in East New York. But we also are opening up a Without Walls program in Brooklyn. Yes, Heaven's Hands is opening up a Without Walls program in Brooklyn. So if you have any questions, any concerns, you can give me a call. I'm going to put my phone number and my email address in the comment section. And I look forward to hearing from anyone that has any questions or if you're looking to set up a tour. Thank you.
Brian, I have a question. Brian, I have a question for the beautiful Erica. And Erica, can you please look on the chat? My second question. But my first question is, do you have a date for the opening?
A date for the opening of the Date Without Walls?
Yeah.
We're currently taking applications and we're currently having conversation with families
Yeah,
and
once
with
people are
care
enrolled.
managers.
Oh, so you're not doing a grand opening party?
It's
I
a
don't
Without
believe we'll
Walls
be doing
program.
I know, but I said grand opening. I didn't say on walls. That's why I
Okay.
got you too.
Thank you. Thanks, Erica. All right, Matthew from YI.
Hello, everyone. This is Matthew Sang with YI's CFS department. So we do have openings in the Independent Living Skills program, in-home behavior management program, parent with special needs program, and particularly the ballet yoga social skills program for children with autism diagnosis. I'm gonna put the flyer in the chat once again. I did it earlier before at the start of the meeting, but I'm gonna put the flyers information in the chat. Thank you so much.
Thank you, Matthew. Pat from GHO.
Hey, good morning. Pat Liu, Family Support Coordinator from GHO. GHO has opening. For waiver service, we have a ComHab, site-based day hab without wall, and community-based Prevo, and other job training program. For our family support service, we have family support case management service to assist family who are new to the system. We can assist them with information referral service in language, public benefit and entitlement, and OPWDD eligibility, family reimbursement, and CCO enrollment. And we have a bilingual speaking staff available. We have we can speak in Korean or Chinese, and I will be the contact person. My phone number is 718-307-6563. And also we have a contract with CDNY to help family who speak in Korean or Chinese to assist with their enrollments. So give us a call. I will put my contact on the chat too. Thank you.
Thanks, Pat.
You're welcome.
Lindsay from Goodwill.
Hi, good morning. I'm Lindsay Stilson. I do outreach and marketing for Goodwill. We have openings in our Day Hab Without Walls, community-based Prevoke, Respite, Advanced and SEM services, with a focus on gaining independence and employment. Also, I'm hosting an open house for our Brooklyn Possibilities on October 21st from 2:30 to 4:30. I will share the flyer with the council, but if you have any questions, please call or email me, and I'll put all my info in the chat. Thank you.
Thank you. And it seems last but not least, Sandy from Adapt.
Hi, everyone. I have some great news. Adapt Community Network is having their free virtual 2025 summit Wednesday, November 5th from 10 a.m. to 3 p.m. Topics will include self-advocacy, life transitions, and informed choices. Spanish, Mandarin, and ASL translation will be provided. I dropped everything in the chat plus the flyer. Also, to add to Paola's announcements, we are having a free webinar on the Ombuds program, and we'll be explaining everything about it. Rachel Schumann will be our speaker, and you could register by emailing familyconnect@adaptcommunitynetwork.org, or you can look at the chat and there's a link where you can register, and I also dropped a flyer in the chat. Thanks, everyone. Have a great rest of the day.
Thank you, Sandy. All right, so I believe we got in right under 12 o'clock. Appreciate everyone being here. Thank you so much, Ruth, for coming on for that presentation. Thank you to everyone from OPW and IAC and all my chairs and co-chairs and everyone else from the council and all the families and agency representatives. Please keep an eye on our website, Facebook, YouTube, and it provides all the ways to contact us. Have a great week. Have a great end to September, and we will see you soon. Thank you, everyone.
Happy Rosh Hashanah.
Happy Rosh Hashanah, everyone.
Have a good day, everyone.
Have a good day, all.